So, practice of healthcare. Healthcare practice is a function of clinicians' understanding of and conforming to both federal and state and regulations regarding medication prescribing. So in best practices, these are health practices, methods, procedure, or techniques. In health practices, there are protect, promote, maintain health and well-being. So in promote, you can promote a healthy lifestyle through social media, just like today. And many healthcare practices that promote in social media, but also in TV, radio, or etc. It helps you maintain or improve your healthy lifestyle, and at the same time, it helps to prevent disease, disability, or death. Next is the maintain health and well-being. By eating a healthy food for something that can maintain being healthy. A healthy behavior or practices that you might do in order to keep you healthy in your day-to-day life. So first one is eat a healthy diet. Next is consume less salt and sugar. Reduce intake of harmful fats. Exercise regularly and be physically active. And don't smoke. Avoid harmful use of alcohol. Check your blood pressure regularly and get enough good sleep.
Good day everyone, I am John Rene Narasan and this is my assigned topic. Strategies and intervention. We have the hospital level intervention and the individual level intervention. When you say hospital level interventions, these are implemented by means of changes in hospital policies, processes, systems, procedures, and structures. And lastly, we have the individual level intervention. So individual level intervention, this is implemented to change individual knowledge, attitudes, or skills by means of tools for educating, informing, activating, and engaging individuals. So, I have the procedures or techniques. First, analyze their data and outcomes. Second, set goals. Third, create a balanced team. Fourth, include human factors inputs. 5. Create an executable plan. 6. Become familiar with the PDSA cycle. And lastly, communicate goals and progress. So, medical sociology studies the practice of health care. It is also focuses on the trainings and behavior of physicians and other healthcare professionals. Medical sociology also focuses on the functioning of hospitals and the delivery of healthcare services. So, medical sociology has specific topics in this line of research. It includes the socialization of medical school students, the relationship between physician and patients, the experience of being a hospital patient, the impact of not having healthcare insurance, and lastly, the inequalities in the delivery of healthcare based on social class, race, ethnicity, gender, and other social factors. So, socialization of medical school students, socialization into clinical duty is difficult part to confusing around students new rules and expected behaviors. Among students entering new undergraduate clinical duties, this is to investigate reported proactive behaviors and their association with social integration and enabling and inhibiting factors for proactive behavior. These are necessary for guiding personal feelings, beliefs, and values against interfering in the formation of medical school students. So the relationship between physician and patients is based on trust, which gives rise to physicians' ethical responsibility to place the patient's welfare above the physician's own self-interest or obligations to others. to use the sound of medical judgment on the patient's behalf and to advocate for their patient's welfare. That's all. Thank you.
The continuation of Rene's topic is the experience of being a hospital patient. A patient is a person who receiving medical treatment from a doctor or hospital. A patient is also someone who is registered with a particular doctor. Means a patient is necessarily and continuously confined to hospital under the care of a medical practitioner. So last is the impact of not having health insurance. Without health insurance, finding affordable and appropriate care can be challenging. Uninsured individuals are less likely to have access to necessary medical care and often delay treatment due to cost concerns.
The importance of healthcare. Healthcare is very important to people because without access to healthcare, people are far more at risk. High quality healthcare helps prevent diseases and improve quality of life. Providing social health protection and equal access to quality healthcare has significant positive effects on individual and public health, economic growth and development. Diseases, malnutrition, pregnancy, all can become incredibly dangerous without proper health and support. Healthcare is a part of life we all consider to be something we are entitled to. It's our right to have access to healthcare whenever we need it. However, for many people, access to the work.
Good afternoon, everyone. This is my topic, healthcare system. In sociology understanding, emphasizes the influence of people and social backgrounds on the quality of their health and healthcare. A society's culture and social structure also affect health and healthcare. So, the example of the social healthcare is to explore how different groups in society view healing practices and illness, or it can examine social institutions like the healthcare system. And also, medical sociology has greatly contributed to the improvement of the health. Sociological studies have helped illuminate how different groups conceptualize health and revealed that public health system. That's all. Thank you.
Promoting healthy behavior. It involves encouraging individuals and communities to adopt and maintain actions that contribute to their first, physical, second, mental, and third, social well-being. This includes actions like eating well, staying active, managing stress, and avoiding harmful habits. The strategies of promoting healthy behavior is first, providing education. Next, creating supportive social networks. Third, implementing behavioral interventions. And fourth, ensuring access to resources. And last is enacting policies and regulations that encourage healthy choices. So the importance of promoting healthy behavior lies in its potential to prevent chronic diseases, enhance quality of life, extend life expectancy, reduce healthcare costs, address disparities, boost productivity, and have a positive impact on communities and the environment. In essence, it's about empowering individuals and communities to make healthier choices for their overall well-being. So next topic is the social construction of illness. The social construction of illness means that how we understand and respond to diseases is shaped by social and cultural factors, not just biology, society's beliefs, values, and norms. It influences our perception of health conditions and how we address them. For instance, attitudes toward mental health have evolved over time due to changing societal awareness and acceptance. The concept of the social construction of illness. First is the perception by society. The perception by society. It is illnesses are not solely biological but are also shaped by how society defines, interprets, and responds to them. Next is the influence of social factors. Factors such as cultures, stigma, socioeconomic status, and access to healthcare influence how illnesses are understood and experienced. Next is changing views over time. Society's understanding of illness evolves, leading to shifts in attitudes and acceptance, followed by context matters. The way illnesses are viewed and treated varies across different societies and cultural contexts, highlighting the role of cultural norms and values. Then last is the social and cultural consideration. When addressing health and healthcare issues, it is crucial to consider social and cultural factors that impact how individuals and communities perceive and respond to illness.
Social constructionism. Social constructionism is an approach in the social sciences that emphasizes the role of culture and context in constructing meaning and understanding. It views knowledge as a socially constructed product and sees truth as dependent on consensus within a given community or society, not on any universal or absolute definition. Social constructionism in medical sociology emphasizes that meaning and experience of illness is shaped by cultural and social systems. According to Scaffer 2015, as a first example, many sociologists think race has little or no objective biological reality, even though people do differ in skin tone, hair, texture, and other physical attributes. They instead regard race as a social construction, something that is real only because we think it has real meaning. Race is not biological, it is a social construct, because race has an impact in our identity and life chances that people based on skin color or other physical attributes. Emphasizes how abstract ideas like race, gender, rules, and beauty are not natural or normal. A second sociology examples of social constructionism concerns the possibility that means of conditions or behaviors might be considered as social problems that need to be addressed, even though there is no objective basis for thinking so. According to Moni, Knox, and such, in 2015, race is historically humans have separated and grouped those different skin colors and features. Like money, humans agree on what paper and coins represent. And countries, humans mutually agree and acknowledge their existence. And lastly, gender. Men and women act differently based on dictated gender rules.
Role of social construction of technology. The technology has had a significant impact on the social construction of illness in several ways. First, information dissemination and awareness. Technology, particularly the internet and social media, has made it easier for people to access information about health and illness. This has empowered individuals to research and learn about various health conditions, contributing to increased health awareness and construction of traditional medical hierarchies. Second, online health communities. The rise of online health communities and support groups allows individuals with a specific illness to connect with others who share similar experiences. These communities can provide emotional support, share coping strategies, and challenge traditional medical narratives by sharing personal stories and insights.
The fifth is social media and health trends. Social media platforms have amplified health trends, both positive and negative. It can also disseminate health information rapidly, but it also can contribute to the spread of misinformation and unrealistic health ideas, impact the social construction of beauty and wellness. Number 6, data research Technology has facilitated the collection and analysis of vast amount of health-related data. This has potential to influence how illnesses are categorized, understood, and treated. For example, the use of artificial intelligence in medical research can lead to new insight and treatment options. Number 7, ethical and privacy consideration.
So, good day. I'll be discussing the cultural meaning of illness, contested illness, and the sick role. So, cultural meaning of illness, according to Irving Goffman of 1963, who may think a disease, the stigma, influences how others perceive the unwell person. So, the stigma associated with disease frequently has the biggest impact in the patient and the type of care they get. So diseases stigmatized and which are not, which are judged, constable, and which are not depend on our society, not in biology. So illness that are certainly recognized by the medical community. Conrad and Barker 2010. The stigma associated with disease frequently has the biggest impact in the patient and the type they care. Certain conditions such as mental problems, AIDS, venereal diseases, and skin disorders are discriminated against in our culture and even by the healthcare institutions. Contested illness, systemic exertional intolerance disorder, fibromyalgia syndrome, irritable bowel syndrome, multiple chemical sensitivity, and Morgellons disease, and many more. So the sick rule. Talcott Parson in 1951 theory outlined 2 rights of the sick person along with 2 obligations. So the sick person's right are being exempt from normal social rules and being exempted on normal social rule and not being responsible for their conditions. Thank you, that's all.